The views expressed on this video are that of Gunnar Esiason and guests, and not necessarily those of the Boomer Esiason Foundation. Nothing in this video should be considered medical advice.
Hey, it's Gunnar Esiason here for another Cystic Fibrosis step-by-step video. So now we're going to talk about some inhaled medications. We have the nebulizer, which connects to the neb-cup, and that's how the treatment is administered. The nebulizer compresses air, and the neb-cup is what holds the medication for inhalation. Oftentimes you'll see patients utilizing both airway clearance methods and a nebulizer at the same time. Now, as far as specific medications are concerned, we can talk a little bit about what each treatment does. So what we have first is the bronchodilator. The bronchodilator can be administered through an inhaler, a puffer, or through the nebulizer. The bronchodilator's job is to open up the airways. So now we have hypertonic saline. Hypertonic saline is an inhaled medication that hydrates the airways. Oftentimes people with cystic fibrosis use other medications that also thin out the mucus. Finally, we have the inhaled antibiotic, which is inhaled through the neb-cup and the nebulizer to go in and kill the bacteria living in the mucus within our lungs. Now moving to some of the oral medications, we have the digestive enzymes. In cystic fibrosis, the pancreas is often obstructed, so people with CF have to take digestive enzymes to break down the fat in the food that they're ingesting. Throughout the course of life with cystic fibrosis, we're going to come across more and more terms. These are just a few of them, and hopefully you can familiarize yourself with some of the terms that we come across in cystic fibrosis.
The views expressed on the Cystic Fibrosis Step-by-Step with Gunnar Esiason videos are that of Gunnar Esiason and guests, and not necessarily those of the Boomer Esiason Foundation. Nothing in the Cystic Fibrosis Step-by-Step with Gunnar Esiason videos should be considered medical advice. Such advice can only be given by a physician who is experienced with cystic fibrosis. The Boomer Esiason Foundation, Gunnar Esiason and guests cannot be held responsible for any damage which may result from using the information on this video without the permission of your medical doctor. Thank you for watching Cystic Fibrosis Step-by-Step with Gunnar Esiason, presented by the Boomer Esiason Foundation and GunnarEsiason.com.